Welcome to our channel's question and answer series. We will cover aortic stenosis in this video. Let's jump straight into the questions. What is aortic stenosis? Aortic stenosis is a condition characterized by the narrowing of the aortic valve, which impedes the flow of blood from the left ventricle to the aorta, leading to significant cardiac complications. What causes aortic stenosis? The primary causes of aortic stenosis include calcific aortic valvular disease. This is most common in the elderly. This usually involves an inflammatory process that progresses to calcification. Second most common cause includes congenital bicuspid valve. This occurs in 1 to 2% of live births, often associated with other aortic abnormalities. Other cause includes rheumatic heart disease. This results in progressive fusion, thickening, and calcification of the valve. What are the risk factors for aortic stenosis? Risk factors include older age, male sex, elevated lipoprotein A, and LDL cholesterol, hypertension, diabetes, and smoking, particularly for calcific aortic valvular disease. How does aortic stenosis affect the heart? Aortic stenosis impedes left ventricular outflow, increasing ventricular pressure, which leads to compensatory hypertrophy. This can cause myocardial ischemia, arrhythmias, and eventually left ventricular failure. What are the symptoms and signs of aortic stenosis? Aortic stenosis is often asymptomatic until severe, but symptoms include exercise-induced syncope, angina, and dyspnea. Physical signs include a rejection systolic murmur, a systolic ejection click, and a palpable fourth heart sound due to atrial contraction. How is aortic stenosis diagnosed? The main diagnostic tool is echocardiography, which shows valve thickening, calcification, and the extent of left ventricular hypertrophy. Cardiac catheterization is rarely needed, but may be used to confirm the diagnosis if necessary. What are the management options for aortic stenosis? Management primarily involves surgical intervention, such as valve replacement, especially for symptomatic patients or those with significant aortic stenosis detected on echocardiography. Balloon valvuloplasty may be an option in selected cases. Regular monitoring with echocardiography is crucial for asymptomatic or moderately affected patients to decide on the timing of intervention. What are the complications associated with aortic stenosis? Complications of aortic stenosis include heart failure, arrhythmias, sudden cardiac death, and in some cases, infective endocarditis. What is the prognosis for individuals with aortic stenosis? The prognosis for aortic stenosis can vary widely based on the severity of the condition and the presence of symptoms. Those without symptoms can often survive for many years without issues, but regular monitoring is essential to detect progression. Once symptoms develop, the prognosis worsens significantly, with a high risk of death within 2 to 3 years if left untreated. The timely surgical intervention, typically valve replacement, can substantially improve outcomes and quality of life. Thanks for tuning in. If you've enjoyed or learned something new, please give us a thumbs up and don't forget to subscribe for more content. Share your thoughts in the comments below and join us again soon.